Evening, everybody, and welcome to tonight's panel. This panel is called The Generational Divide, How COVID Has Affected Older Adults. And it is the second in a three-part panel series, discussions hosted by the URI Academic Health Collaborative and the Interprofessional Education and Practice Initiative. We are very excited to be here and sponsored generously with funding through the State of Rhode Island Executive Office of Health and Human Services. So it's my pleasure tonight to introduce our panelists, starting with myself, your moderator. I'm Catherine Taylor. I am the Executive Director of Age Friendly Rhode Island, which is an initiative of Rhode Island College, but I'm also a project advisor at the Geriatric Education Center here on campus at URI. And I worked here for the last 4 or 5 years at the Ryan Institute for Neuroscience and at the Geriatric Education Center, and as previously the State Director of Elderly Affairs, which is now the Office of Healthy Aging. So I'm so pleased to be back with all of you and with some wonderful colleagues here. So the rest of the panel is, first of all, Dr. Skye Liedall, who's going to lead us off with a presentation on some stark statistics on how COVID has affected older adults in our state. Dr. Liedall is an associate professor at URI with a joint appointment in the departments of Human Development and Family Studies and Political Science. Prior to joining the faculty at URI, she worked in nursing homes for a US Senator, at a community action agency, and as a research project coordinator for various state-funded program evaluation and research projects. Dr. Liedall's research is focused on improving social integration and health for older adults and developing and evaluating intergenerational programming. Together, she and Dr. Estes lead the URI Cyber Seniors Program. Next, we have Victoria Parker. Victoria is currently the Education and Research Associate at PACE-RI, overseeing the robust student internship program and staff education and training. She often works closely with the clinical and administrative teams. Victoria has been employed with PACE-RI for 4 years. She holds a bachelor's degree from URI and is currently pursuing a master's in healthcare administration at Rhode Island College. Dr. Erica Estes is clinical professor at the URI College of Pharmacy. Her teaching, service, and scholarship activities are closely intertwined within her areas of interest focusing on older adults. Dr. Estes is actively engaged with many local and national pharmacy organizations and committees focused on student education and older adults. And next we welcome Peter Bristol, who's a member of the Osher Lifelong Learning Institute here on campus. After graduating with an MS degree at URI, Peter worked for 34 years in Ohio and Illinois at Arboreta and Botanic Gardens, where he was responsible for the development, use, research, and interpretation of preeminent collections of woody plants. Upon retiring, he and his wife returned to Rhode Island, and we're glad about that. And then last but not least, we have Pauline Mburu, who's the Director of Social Services at Woonsocket Health and Rehabilitation Center. Ms. Mburu earned an associate degree in human services at CCRI, a Bachelor of Social Work at RIC, Rhode Island College, and a Master's in Human Service, Organization Management and Leadership at Springfield College. She spent 20 years in health and human services and served populations of people with developmental disabilities, geriatrics, homeless, and people with addictions. Welcome to everyone. We're so glad that you're here. And I'd like to turn this over to Dr. Liedall to share her presentation and get us started.
Great, thank you. Screen look okay?
Looks beautiful.
Okay, great. So yeah, thank you so much. My name, as Catherine nicely said, is Skye Liedall. I am an associate professor of aging and health, mostly within the Department of Human Development and Family Science, and I teach many of the gerontology classes on campus. I'm just helping to open this panel with some information about how older adults have been impacted during the pandemic to provide us some context related to the information we are discussing today. This is just to provide a sense of how the pandemic has impacted older adults and aging services in Rhode Island. But of course, the overview is by no means meant to be encompassing of the many changes and impacts that have occurred with the older adult population. And thank you to the many individuals and organizations who shared information with us to help in putting this introduction together today. So older adults are generally considered those 65 years of age and older, though many organizations, and including Rhode Island in this context, often state older adulthood at age 60. And so just to kind of walk through the next couple of slides here, the first one, where are we now across the US? Well, as of kind of the end of September, there were about 7 million cases of COVID-19 in the US, and about 10.8% of them were those age 65 and over. However, when you look at the deaths being about 200,000, about 58.6% occurred for those 65 plus. In Rhode Island, it's even a little bit more stark for older adults. And so of the Rhode Island cases, about 24,000, 27% of them occurred with those 60 and over. And then of the deaths, about 1,100, and 93% of the deaths occurred with those age 60 and over. And so now turning to some of the services to the way we'll be mentioning today. Regarding nursing facilities. And so this is referring to skilled nursing facilities that provide 24-hour care to those that need it, oftentimes referred to as nursing homes. So you might hear that today. But pre-COVID, one statistic I always like to share with my class that kind of helps to dispel any kind of myths is the reality that only 1% of the US population lived in a nursing home pre-pandemic. And in Rhode Island, it's even less than that. Only 0.72% of Rhode Islanders lived in a nursing facility. So very small percentage. However, then that makes these statistics even more disturbing, with about 42% of the deaths overall in the US occurring in nursing facilities. And then that number being higher in Rhode Island, with 78% of deaths occurring in nursing facilities. And then adding to that statistic a little bit, there have been 775 deaths in nursing homes out of about 7,500 total. And so that means that about 10% of nursing home residents at one point died due to COVID. So as you can imagine, these deaths and then fears about loved ones being in nursing facilities has led to fewer beds being filled. And so pre-COVID, nursing facilities saw about 87% of their beds filled, whereas September 2020 data showed that only about 75% of those beds were filled. And so this, of course, has financial implications for nursing facilities in Rhode Island. And right now, the Executive Office of Health and Human Services has a grant opportunity out for transformation of the nursing home model and working to reduce the number of unused nursing home beds, trying to figure out ways to diversify their use, and then creating services to support expansion of needed services in areas such as dementia care. And so now we also work to find some information about more community-based aging services, looking kind of pre and post-COVID. I guess not post, I always want to say post-COVID, but we're during right now. And so that just to provide some context of the impacts across the state. And so the first one I'll talk about is an organization called PACE of Rhode Island. And so PACE stands for Program for All-Inclusive Care for the Elderly. This is an organization that provides health care and health insurance to those 55 plus who would otherwise be eligible for nursing homes. And so just to talk a little bit through PACE, pre-COVID, they had about 344 participants, and this was right around March 1st. During COVID, those numbers actually stayed pretty much the same. And so as of June 1st, there were 350 PACE participants. So while this doesn't maybe sound overly startling, the reality is that PACE of Rhode Island was one of 5 PACE programs across the United States with continued growth. And so that's pretty impressive for this organization. And importantly, this doesn't mean things haven't changed for PACE of Rhode Island. The reality is that the PACE 11-member interdisciplinary team has shifted to providing most of their care in the home, since fewer participants are able to come to the day center where they would normally receive health and social services. The team members are going to the home with appropriate PPE, of course, to complete assessments and follow up with participants. And clinicians are using telehealth as much as possible. And so Victoria Parker on the panel today can talk more about that particular organization. So senior centers are an incredibly important resource for older adults living in the community. And so these centers are in nearly every community across Rhode Island, and pre-COVID provided a large variety of services and supports. So we're talking everything from meals to exercise to game clubs or social clubs, book opportunities, transportation services, social services, help for people getting enrolled in programs, counseling for health insurance, and all of this was offered sort of in a center. But during COVID, these centers all had to close down for any kind of in-person help, but they really got creative with their mix of services. And so they now have a mix of meal delivery, grab and go lunches, phone consultations, virtual activities, sort of phone check-ins, some outdoor activities are offered, and flu clinics as well. So Meals on Wheels is another program that has seen pretty significant growth due to the pandemic. And so in 2019, Meals on Wheels provided about 2,500 home delivered meals and had about 595 clients who were taking part in the Capital City Cafe program, which was more of a social opportunity for people to have meals together. And so they were providing or delivering about 1,200 meals to the clients statewide. Since the pandemic, the Capital City Cafe program had to move all of their meals to being home delivered. And so thanks to funding from the CARE Acts, they moved to delivering these frozen meals statewide and cooperated with many of the municipalities across Rhode Island. And so at the height of the service, they were delivering an additional 1,800 meals per day for a total of 4,000 meals then compared to that pre-COVID number of 1,200. So adult day programs, it's another important service that helps to provide day support to help alleviate the burden of family caregivers. And so pre-COVID, there was about 32 of these open across the state. During COVID, all of these centers closed down. Thankfully, by August, 22 have reopened, but the reality is that, there still are many that are closed. Many of the respite services and other informal supports that were available for family caregivers prior to the pandemic are not there. And so there's many family caregivers in Rhode Island in need of help and support. Telehealth, another interesting change with pre-COVID, telehealth not being very readily available for people. It was much more of maybe in rural areas or for specific populations, but big change came. Medicare, Medicaid, and other health insurance plans all are now providing telehealth reimbursed through their plans. And so providers are able to receive the same reimbursement that they would have received in person, now via telehealth. And so a recent statistic shows that about 32% of older adults have had one or more of these telehealth visits. And so this has certainly gone down sort of since the height of the pandemic, but it's sort of in that trying to find the sweet spot now for where, what services kind of work well for telehealth and older adults and other patients, and just kind of figuring out what will be sustainable. And then an issue that we wanted to address and bring up had to do with social isolation and loneliness for older adults across the US. So prior to the pandemic, some statistics were 43% of adults age 60 and older reported feeling lonely. About 25% reported being socially isolated, and about 26% lived alone. And so while I don't have any current data using those specific measures, there is definitely evidence that this has only increased due to the pandemic. And so some of the immediate effects of social isolation relating to the pandemic have been observed: surges in mental health concerns, substance abuse, domestic violence. Early observation also suggests people having more sleep difficulties, emotional or overeating, and just serious health challenges. So as this picture shows with this comparison that social isolation is about as bad as, smoking, lots of packs of cigarette per day. It's a reality that social isolation and depression have been linked to premature death, dementia, and heart disease. And so certainly a major concern for people in Rhode Island and those who provide services to older adults in Rhode Island. And so as you can imagine, throughout the state, many programs and organizations move their programming online or via phone as much as possible. And so we mentioned senior centers and PACE, making as many changes as possible. But the Alzheimer's Association, another one that moved all their programming online. State-funded case management services is now available via the phone. AARP moved all of their educational programming online. The Senior Corps program, which offers the foster grandparent program, moved things online and is working to provide Chromebooks to their volunteers so that they can continue to volunteer in the schools. In many residential sort of housing settings, most of the community rooms closed with some limited reopenings now, and those sites are getting more creative about trying to provide socially distanced opportunities and virtual opportunities. So Cyber Seniors, the organization that was mentioned that Dr. Estes and I run for students, we've moved a lot of our programming via phone, digital, and so we work to provide support where students work with older adults in the community to help them learn technology and ensure more digital inclusion for that population. And then the Osher Lifelong Learning Institute, we have a representative from there as well today, and many other educational programs across the state have moved to virtual learning. And so then some new projects have come up. And so Project Hello is a new project through the Office of Healthy Aging, and they are also working on a large initiative called the DigiAge initiative. And then the Age Friendly Rhode Island organization started the Virtual Community Center. And so many organizations working together to try to provide these innovative opportunities during the pandemic.
Great, thank you so much, Sky, for that incredibly well done overview of the amazing changes that have happened in the landscape affecting older adults in Rhode Island since the pandemic started. Now we're going to bring the overview down to the ground, onto the ground, folks who've been living it all along. So I'd love to start with you, Victoria, and ask you if you would share your experience working with older adults during the pandemic. Where were you working, and what were some of the unexpected experience that you had? And in your case too, I'd love to hear you reflect on how your URI training played in.
Sure, thanks, Catherine. So as Dr. Liedel mentioned, PACE Rhode Island is a nonprofit. It's a full service health plan in Rhode Island that is serving older adults. We define that as age 55 and up, so we go even a little younger. Everyone enrolled in PACE is nursing home eligible, but they are living in the community and in their homes with our support. So one of the key services that we provide at PACE is our day center. And as you can imagine, during COVID, we had to really limit attendance. And so before COVID, we had about 90 people coming to our center every day who were receiving services. And then with the stay-at-home order, we were down to maybe 3 or 4 participants in the center every day. So that was a pretty significant shift, of course, to community-based care. And I think what was so surprising about the entire transition was really how resilient the older adults and their families were in just sort of going with the flow, learning with us, welcoming us into their homes more than ever before, welcoming new technology into their home and just being open to learning it, because really for some, that was the only way we could connect with them. And so this resiliency was just really surprising. And heartwarming too, just being a part of the organization and helping older adults as much as we possibly could. And in some ways, it sort of made me think, before the pandemic, were we sort of blocking our creativity? You know, we spent so much time making the center this amazing place for care when we could have been reaching participants in their homes or anywhere that they are. So it's really made us be more creative and just find different ways to connect and engage with the participants we serve. And given that I graduated from URI in 2016, I was in the Human Development and Family Studies program of study there. And one thing that I reflected back on my learning at URI is just how community focused it really is. It seemed like every semester I was going into the community in some way, doing a field work, a placement somewhere in a school, in another community-based organization. And so that, that really had a big impact on my ability to transition. PACE has always been a community-based organization, but now more so than ever. And so I think, some of that experience in other community-based programs in part of my study has helped me, being able to transition now working at PACE in the field in a community-based organization. So certainly the community focus at URI was important and has helped me now. And as Dr. Liedel and Dr. Estes also mentioned, the Cyber Seniors program I was a part of at URI. And thinking about that 4 years ago now, we didn't know how important it would be. Now that technology is such a key factor in connecting people during the pandemic. So I'm really happy that it's sort of getting the limelight it deserves, because at this point it is really useful and effective for communicating and connecting with older people in the community.
Thank you, Victoria. That's all really actually very exciting to hear. And I realized in my excitement to get to you, I neglected to ask folks who are participating in this webinar to write your questions in the Q&A, not the chat, but the Q&A as they occur to you as you're listening to the panelists. And towards the end of the program, we will get to them and hopefully get some of your questions answered as well.
Okay, it appears we lost Catherine temporarily. I'm sure she'll be back in a moment. If
So Ian.
There we go. I was going to ask if
Ian,
Elizabeth or Barbara could jump in.
Yeah, Ian, so let me just say I'm up in Providence where Catherine is too, and there's a terrible storm going on, which I think may be causing us some difficulty. And I had just run to close my window, so I know Victoria had finished her comments. And I didn't know if Catherine had turned to someone else to talk about their experience. If not, I might like to actually ask Ms. Mburu to talk about her experience at the Woonsocket Health and Rehab Center.
Thank you so very much for inviting me to represent social work in this panel. I've been a director of social services at Woonsocket Health Center. And of course, as a social worker, we are used to being able to help people solve their problems, but with the pandemic, truly, it was very, very difficult and frustrating. That said, we've learned a lot in the process. And obviously, initially, it was very, very difficult to even explain to patients and residents, some of them with memory problems, what's going on. So that became a very big challenge because they really could not understand what was going on. So in the end, we actually felt that they did better than we expected. I think we don't give them as much credit as they deserve. They were very quiet, they were very understanding. And I think one of the things is because we are a family. I think a lot has been spoken about isolation and loneliness, but we are their other family. And when we are here, we are able to calm them down and give them most of what they would look into as, a family would. That said, we cannot replace their family. And obviously the challenge at that time was communication. I never really imagined how difficult it would be dealing with people in their 70s and 80s and asking them whether they are aware of what Skype is, or Duo, or FaceTime. And some of them have very basic phones, and trying to ask them to download that and be able to do virtual communication because became a whole day event. But I must say, we have very young frontline staff who are very, very good. They would walk them down, and we would be able to get a virtual communication done. So those experiences were very nice. And I know, as in every other home, we did lose some of our patients and residents, but we are doing very well. We are doing very well. We've learned a lot of things that we did not know. Obviously, nobody could have been prepared for it. And one of the other thing I really came to understand is that even our staff needed a social worker. We don't have a social worker assigned for the staff. And it became my responsibility to call them and find out how they're doing. Obviously, mental illness goes, it's in our culture, in our society. So I had to reach out to those that were anxious, find out what they need, try to support them. And they have all come back. So that's good. So most of my experiences have been good. We are doing very well, and hopefully we will learn from this experience.
Thank you so much for that. And I apologize, everyone. This raging storm outside knocked out my internet for just a second. So I'm glad you just jumped in there. And again, just such a positive story. And I find that unexpected considering the statistics that we all heard. So thank you for all that creativity. So Dr. Estes, did you get a chance to speak while I was offline?
No, I have not.
Good. I'd love you to answer the same question. Just, in your work as a professor of pharmacy and your work with the community, how did your work change, and what have you seen that's been unexpected?
Well, I think most people can relate to what happened back in March when we all knew something was changing, and specifically because I work with older adults so closely, I knew that obviously that population would be affected. And so when I started getting emails from some of the senior centers where my students are doing activities, and even at the senior living community where I work with, and it was like, okay, visitors are on hold for a little while. We're just going to kind of see what happens, and maybe in a week or two we'll be able to let people back in. So it was kind of like, all right, let's just see how this goes. And then the next thing you knew, the students were on spring break, and basically nothing ever went back to normal. And that was back in March. So I for one, was not expecting it to be this long. And then even sort of planning out events and different activities and all kinds of things that we're doing now in the fall, we were very optimistic that, oh, well, things will be better, and then now we're even looking out weeks from now. So, but not in a doomsday way. I think now we've all learned a lot. And I think we can all do things more efficiently. And I really love what Victoria said, how the creativity, I think, has been really positive. I think we've figured out ways to connect with older people, and we're giving them a lot of skills that they didn't think they could do. And that's been really kind of amazing. And to see the intergenerational aspect of that, having some of the students helping the older people. I actually brought a few older adults into my class at URI the other day via Zoom. And so we did an activity where students were practicing with telehealth, and which is very timely with what we're all talking about now, because this is something that obviously we're doing. And so they had to figure out how to do some assessments and do different things over the phone. And we did it via FaceTime, just practicing with those skills with volunteers. And then we brought them into class on Zoom as part of a panel, and they were so excited to be in the class with the students, and they didn't realize how many people were there, and they were kind of talking to each other through the gallery view and how they were kind of like helping each other out. It was kind of amazing. And so just seeing that intergenerational aspect, I think, has been just kind of great. So I'm really excited about that. And I think older people in the community especially never really had to look to technology because they were always doing stuff. And one of the senior communities I go to, that was the comment, was they never had to have an iPad because they never had to use it because they were always just going out doing their own thing. And now they're forced all of a sudden learning these skills And I can speak for my family. You know, we were doing weekly Zoom meetings and doing these things that we had never done before. And why weren't we? Why weren't we connecting that way? Why weren't we seeing everyone all at the same time? So I think when you think about some of the, I like to call them COVID wins, we have to kind of take them when we get them, because some of them can be pretty great.
For that, yes, creativity really seems to be the theme. Peter, I would love to move on to you now and have you share your experience. And how has your, what's your life been like over the last 6 months? How has it changed?
I guess, first of all, I want to thank everybody, especially those on the panel and your peers, for doing all the work that you're doing. So a person like me can understand what's happening out there. And I can hopefully take some of your statistics and show them how they're actually working for me. And I started off today. It was a marvelous day before the rain, obviously. And I was taking a walk, and I walk often down the road, and just listening to the leaves under my feet, listening to the wind and the trees and the leaves, and thinking, this is great. This is really great. And then I thought about, well, this is Wednesday afternoon. On Wednesday afternoon, I'm usually out with the Ollie group, walking on a trail someplace in South Kingstown or Exeter, and enjoying maybe 10 to 12 other people with me, and socializing, and it's gone. Can't do that. I was walking down the street by myself. A little bit more background. You heard about my academic and my work field. I'm in my mid-70s. I have 2 daughters, 5 grandchildren. I retired, as was mentioned, I retired in 2006. And all of us, including the students that are listening, have gone through life-changing experiences. And in 2010, I had one of those, what I call a sucker punch. It hit me right on the side of the head. Unrealized, but if I thought about it, I should have known about it. And that was, my brother was diagnosed with Alzheimer's disease. And this was a wake-up call, simply because my mother also died of Alzheimer's. And doing some homework, going back to school, thinking about what my future might be, I was thinking I might have Alzheimer's. And one of the indications, besides the genetics, was that I was forgetting things. As I mentioned, as was mentioned, I was working in Botanic Gardens and Arboreta as manager, director, curator of the woody plant collections. Trees were my friends. And all of a sudden, I couldn't remember my friends, the trees especially. So, as I say, I went back to school and found out that one of the leading institutions for Alzheimer's was right here in Rhode Island at Butler Hospital. So I went up there, talked to the people up there, had a cognitive exam, found that I had what they call MCI, mild cognitive impairment. And I was also, at that time, eligible for a trial. This is what they call a pre-Alzheimer's treatment trial. And I felt very fortunate to be part of that trial. I'm still in it after 6+ years, still going up to Butler, but it's certainly established what my future was going to be. In my reading and studying, and every one of the people that are here today will agree that there are certain lifestyle changes that need to be made, especially when it comes to cognitive impairment. There's nutrition, exercise, brain stimulation, and socialization. Well, 3 of those 4 were introduced to me through a membership at OLLI, the Osher Lifelong Learning Institute. This organization has a very close relationship with URI. You've heard some of the speakers this evening mentioning the relationship with OLLI and how their students cooperate with the Institute and help our members at OLLI. It offers diversified classes, activities for individuals, and we choose 50 years or older in our group. Just for an example, especially for the students that might be interested, we offer classes in arts, current events, environment, foreign language, health, wellness, history, literature, math and science, philosophy, religion, politics, government, and technology. And it was mentioned also about cyber seniors. We have 1 or sometimes 2 of the pharmacy students come into the OLLI building, which is on campus, to the OLLI office, and help the OLLI members with technology. How do I use my iPhone? How do I use my iPad? I can't get this to work. I can't get that to work. These young students are whizzes at this thing, at at technology, and have been a tremendous help to us. As I mentioned earlier, we have these special group activities like walks, biking, bridge, writing workshops, and also aging wellness, which of course is important to all of us as we age. So it is important to keep that socialization, brain stimulation. I also joined another organization, so this makes my 3rd. This would be Butler Hospital, OLLI. And this 3rd organization is organized by the Home Care Assistants of Rhode Island in cooperation with the Contemporary Theater Company here in Wakefield. And essentially what it is, it's an improv workshop for individuals with dementia and to bring a better quality of life for these particular individuals. Now let's fast forward to 2020 and what's happened. All of these feelings have been expressed and will continue to be expressed during this panel discussion. Risk, fear, change, anxiety, solitude, confusion, inconvenience, depression, frustration, all of those. We have experienced, and I say we, my wife and I, and even my daughter and grandchildren who live nearby us have all experienced this. And it's frustrating. To review the nature, the nutrition, exercise, and brain stimulation program I was under, Butler's monthly infusions were canceled for 2 months. It's now started up again, and I can get out of the house. I go up into a very safe environment and can continue with the Alzheimer's treatments that I've been getting. The OLLI classes were canceled, but they've been restarted virtually. It was a quick learning program. Everything was done by paper. When I left the OLLI as a volunteer in March and they closed the door. Everything was handled by pieces of paper and the telephone. And now everything is handled virtually. Their membership, they converted everything over to the computer as much as they possibly can. So now we can take classes again virtually. The improv workshop canceled. However, they set that up virtually too. And I thank goodness for that, because we don't have the physical contact, the socialization is there, but it's a virtual socialization. It's not the same, but at least it's something. And as we all know, how much fun it is to go to the grocery store to find good, nutritious food, and you get the, oh, it's the supply chain. No, I'm tired of hearing that. That's the way it is. We work with it. I guess what's most difficult is that walking around the block, we wave to our neighbors. We may shout across the street at our neighbors. But here's an instance. We had a new neighbor just move in next door about a month ago. What would typically be the situation? You bundle up a casserole dish and you go over and say hi to them. Welcome to the community. Nope, can't do it. There was a friend that just this last weekend we hadn't seen in a year. What's the first response? Go up and hug them. Say, good, it's good to see you again. How have you been? Socialization, gone.
Peter, thank you so much for that incredibly powerful account of how the most important things have altered in such profound ways. I know we hope we can get back to life as it was sometime soon, but I think it's a moment, since we have a panel that's coming at the changes from such different directions, I'd love everyone to think about, especially how teaching is done in the Academic Health Collaborative and the Institute for Health and Innovation at URI, in terms of teams and interdisciplinary responses. How could a team-based and interdisciplinary response to care in residential settings and in the community change the impact of COVID on older people? And can you think of one particular experience or event that you can point to during the last 7 months where your thinking about teamwork was either reinforced or changed? Let's go back to you, Victoria.
Great. So the PACE model, and really the cornerstone of the PACE model, is our interdisciplinary team. And it is 11 members of non-clinical and clinical people who meet every single morning, and they talk about participants and what's happening. And of course, most of the conversation these days are about COVID and who's isolated and who needs a visit today, and sort of what's going on there that really demands the conversation in team. But one example, and I'd love to share this because it's just such a PACE story. We had a participant, an older woman who needed to go to the hospital. She was refusing to go. She didn't want to go. But really, we knew how important it was that she had hospital level of care. She was that critical. And the reason she didn't want to go to the hospital is because she has a cat who she loves and adores. And so the team was talking about this in our morning meetings. And we said, okay, if the only way she's going to go to the hospital is that her cat is taken care of, then we as a team will create a schedule and we will take care of her cat while she is in the hospital. So it's such a great story because I think it really highlights how teamwork is reinforced and how an interdisciplinary team can address things like social determinants of health, for sure, but it also addresses just things that are unique to a patient, and it helps you meet the needs of the patient or the participant or the client in really unique ways. And so for this person, it meant that we had to take care of their cat, which we loved doing, and we jumped right in. And I'm proud to say that she's now out of the hospital. She did a short skilled rehab stay, and now she's been reunited with her beloved cat. So our team, I think, a good example of going sort of above and beyond in an interdisciplinary way to do something that is not necessarily, within your own role, but sort of coming together as a team and making sure that participants' needs are met. This is just one unique story of how we were able to do that, but I think it's a good highlight of interdisciplinary work.
Thank you so much. And also the theme of creativity that has gone through this whole discussion tonight. Ms. Mburu, I would love your reflections on interdisciplinary teamwork and how your views may have been reinforced or changed during your experiences of the last few months.
So I'm very lucky to work for a family who own Woonsocket Health Center. The owner is in the office every day, and every day of the COVID, he was here. And I am very happy to say that our team here really went out of their way. One morning I came in and I found the director of physical therapy sweeping the floor. I had the director of nurses passing trays, and everybody did what they could. It didn't matter what department you came from. It didn't matter what you're used to doing, but we had to pick up where no one was. We had lost a lot of our staff because obviously with the policy, they had to quarantine. So we didn't have enough staff for most of the departments, and people did what they could. Also, the staff gave their cell phones to use. They used their cell phones to call family, do virtual, visits with the families. And whatever we needed, other people would bring in food, cook and bring in food for people who were here. And one of the things that we have to remember is that our staff have children. They also have elderly parents at home, but they still came in to work. So I think that teamwork has to do with who owns the facility and how well he does. It begins at the top. So I did see that whole way of people working together in times of need, and also the fact that they could have stayed home because they have children, they have elderly, but they still came in, and that really looking at it, it's really a good team, which I'm really proud to be a member of. Thank you.
Thank you for sharing that. That's really wonderful to hear as well. Dr. Estes, what are your reflections on interdisciplinary teamwork, and how has your viewpoint been challenged or reinforced during this time?
It's interesting listening to the stories just now. I'm thinking in one way as a pharmacist, and I think as health professionals, and if anyone else can relate to this, if you're a nurse, if you're a pharmacist, if you're a physical therapist, you sort of wear that hat. And I think we've all learned to that point that you just kind of jump in and do whatever. And I'm thinking of it more from actually on a personal level, because during this whole experience, I was experiencing it firsthand with my dad, actually, and he has given me authority to be able to tell this story, and I'll be brief about it, but he had a heart attack during COVID, and it was at the time when elective surgeries were not being allowed. And so it was a really scary time, because he ended up being in the ICU, and the procedure that he needed to have, which was supposed to be elective, now all of a sudden became emergency, and we couldn't visit. And, it was really difficult to talk to members of the nursing staff and the physicians. And it was really challenging as a caregiver, as a family member to go through that. And then just kind of knowing on the other side how difficult it was for the healthcare professionals that have to do it every day, and so you kind of get pulled, and you sort of, it's hard to think clearly when you're in it for the moment. But the most challenging thing, I think, from all that experience was just the frustration of just not being able to help him through that. When he had to go see the physicians after and have to wait outside, and to have him go in by himself. And at one point we had to have the doctor call, and I was in the parking lot in my car, like on the phone while he was in the office, So all those things that you take for granted, and that you just try and deliver that kind of care as a health professional, it's so much more challenging when you're going through it yourself. And so that was something that I sort of experienced that I wasn't expecting. And luckily it actually had a very positive outcome. So I will say that. but certainly going through it during COVID was unlike anything that any of us had ever experienced. And it's really interesting with the student perspective now, because we have an activity going on where we're, it's called a senior day kind of a thing, where it's with the physical therapy program, pharmacy, nursing, nutrition, speech and language, and we have some other disciplines, and even Johnson & Wales is involved. And the students are getting to work with that firsthand on teams. And that's really great for them to learn that now, because this is something that everyone gets thrown into later. And so to have the experience now working with those disciplines and working with real older adult volunteers as they kind of work through some issues and figuring out how to communicate, you know, not to drop the ball, to make sure that the assessments are being done, to make sure that you're communicating as a team, and learning those skills in undergraduate training, for instance, and then going into graduate programs as well, like for instance for the physical therapy students and the doctor of pharmacy students. So it's really been exciting to see it on both sides too. And I think they're definitely getting a benefit from that, living it firsthand right now.
Thank you for that. I was really curious about how it's affecting your teaching and your students. And then Peter, I'd love to move on to you, and sort of someone who is the recipient of care with your experience at Butler Hospital and in you know, in other settings too. What are your thoughts about the importance of team-based care and different medical disciplines working together? And you know, is there something that you've experienced that makes you see that that's important or changes your mind about that?
Well, that's easy to answer because all of you have provided me with an education as to what you're all doing out there. And I think I wish more people than, what do we have, 60 people here, could be listening to this, because it's amazing the services that each one of you are providing. There's one thing that I feel, because of my relationship with the OLLI program, working as a volunteer there and dealing with people that are 50 years or older, has taught me a lot. And there's one class that I attended there, which has taught me probably more than my years in college. And I want to pass this on to everybody in some ways, and it's called mindfulness. And you, Catherine, have basically said creativity. And I kept thinking in my mind that COVID, if we put our mind to it, is actually providing us with new opportunities to be creative. And I can see that when I was taking my walk this afternoon, just listening to the trees. That's mindfulness, being there in the moment. And every one of you this evening has illustrated that with what you're doing with seniors. And I certainly appreciate all of it, as do, I'm sure, that the people that you are working with directly. My little mantra is, whatever happens does happen. Learn to deal with it or let it go, and never stop learning and seize on each new opportunity.
Thank you for that. That was really, again, so powerful. I'm so glad you're on this panel tonight. We have just a couple of minutes left, and we've got a really terrific question from somebody, one of our audience, which really, Peter, I think in a way you've already answered quite well, but I'd love to just run it past everybody else. The question is, I wonder how moving to a virtual world affects our older adults who so often feel the need to actually connect with a human being. As Peter said, it's not the same, but Victoria, what's been your perspective trying to connect PACE participants virtually?
Sure. I don't think it's the same. It could never replace, sort of human contact. But in some ways and in some instances, many of our participants have actually asked for more connection through technology. In some ways, it is easier for them, actually. They don't have to get on the PACE bus and come to the center and schedule the appointment. And they can see us from the comfort of their own home, sometimes in their pajamas even. And so in some ways, they are asking for more of it. And PACE has actually purchased a piece of technology that is specifically made for an older person. It's called a GrandPad. And the company GrandPad itself, they actually employ older people. Their oldest employee is 102 years old. It's pretty amazing. And so this 102-year-old person has helped build the tablet so that it is purposely made for an older person to use. And so just finding these kind of new forms of technology has made it even easier for that person to connect with us.
Excellent. Erica, I know you have a lot to say on this subject.
Yeah, I mean, it's funny because I was talking to my dad earlier and just talking about that story. I was just telling when Victoria was speaking, made me think about it. And we were talking about when he was in the ICU, for instance, and he had no contact with anyone. We could only call the nurses and check in, and we couldn't speak to him. And because of the way the hospital was at the time, all of the traditional floors and rooms where he would have kind of stepped down to weren't available because they were kind of held off for COVID in case they had to fill them. So he was in the ICU a lot longer than had been. So he was able to use his phone eventually, was able to access it. And that to him was the best part of that, was just being able to see us on Zoom in his hospital bed because we couldn't come visit. And it didn't seem like a big deal because it's just Zoom and you don't think it's real, but for him to be able to see us and talk to us and I think nothing is going to replace that human contact. I mean, the hugging, all of that stuff that people want to do, older adults, when you go into nursing homes, they like to do that kind of stuff. And so when you feel yourself kind of stepping away now because you're trying to protect them, that's hard, but I think to have these tools, I'll call them tools because they're helpful and it really is trying to keep those connections. And I think about a story with the students, which is super funny because I know it's talking about older adults, but the first time we had our Zoom class remotely when we were meeting at URI for one of the classes that I teach in the spring, the students hadn't spoken to each other in so long. And so being on Zoom, and they all put their cameras on, which as you know, with students is kind of a big deal. They put their cameras on and they stayed on like after class to talk to one another. They were so excited. So yeah, it's not the same thing, but I mean, you're still having that engagement. And I think if you can just harness that as much as you can, it's not perfect, but it's certainly better than not having that. I think we have to at least embrace that when we can.
Thank you for that. And Ms. Mburu, you get the last word on the subject of technology and how older adults are doing with that in your experience.
Can you hear me?
I can hear you just fine, yes.
Oh, okay. So I'm going to say, really, as everybody has said, that virtual communication will never replace human touch and connection. I was used to meeting new patients and residents by, giving them a handshake or giving them a hug, depending on what they really were interested in at that time. It's very, very difficult. We have to wear the PPE. You have a shield, you have a mask. How much can you even be able to say to someone when you have all that going on? That said, we have to do what we have to do to keep ourselves safe. So I hope that we'll be able to win this war. And for now, we're going to use the virtual communication because it's the only thing we have. And hopefully things will change in future.
Thank you for that. Pauline Mburu, Peter Bristol, Erica Estes, Victoria Parker, and Sky Liedall, you have been amazing panelists. Thank you so much for just a powerful and moving and uplifting discussion. I don't think I expected it to be so uplifting, but your spirits and your creativity, your wonderful work just really made it that way. I hope everyone will come back this time next week for the third in the series of panels called "And Injustice for All: How COVID Exposes Disparities in Healthcare." That will be next Wednesday, October 14th at 6 p.m. And I think you can register the same way you did for this one. So again, I thank you all for participating and wish everyone the best of luck. Stay safe, stay healthy, and keep the creative juices flowing as a team. Good night.